Hello, my presentation is on hearing. So what is sound? Sound can be both a physical stimulus and a perceptual response. So the physical definition is that sound is pressure change in the air or other medium. The perceptual definition is that sound is the experience we have when we hear. So for example, if it is about to storm and thunder is sounded and no one hears it, is there a sound? In the physical definition, yes, there is a sound because the thunder causes pressure change even if no one hears it. In the perceptual definition, no, there is no sound because no one experienced the sound. So sound, stimulus, and pressure changes. A sound stimulus occurs when the movement or vibration of an object causes pressure changes in the air, water, or other elastic medium, which can transmit vibrations. When someone is speaking, they push the sounding air molecules together, which causes an increase in density of the molecules near the diaphragm. This is called compression. This leads to an increase in local pressure above atmospheric pressure. When the speaker's diaphragm moves back and forth, air molecules spread out to fill the increased space called refraction. The decreased density of air molecules caused by refraction causes a slight decrease in air pressure. This is repeated by the speaker hundreds or thousands of times a second, cause the speaker to create patterns of alternating high and low pressure regions in the air. This pattern of air pressure travels through the air 340 meters per second and through water 1,500 meters per second. This is called wave sound. So some sound definitions. Frequency is the number of cycles per second that the pressure changes repeat. Amplitude is the size of the pressure change. The change in pressure repeats is measured in units called hertz. The pressure of a sound stimulus relative to a reference pressure is measured in decibels. So loudness, two questions that come up with loudness is can you hear it and how loud does it sound? Loudness is the quality of sound that ranges from soft to loud. Decibels are often associated with loudness. 0 decibels is just barely heard and 120 decibels is extremely loud. So pitch and timbre. Pitch, the quality of sound which ranges from low to high. Pitch is most closely associated with frequency. Low frequencies are associated with low pitches and high frequency are associated with high pitches. For example, the lowest note on the piano has a fundamental frequency of 27.5 hertz, and the highest note has a fundamental frequency of 4,185 hertz. Timbre distinguishes between two notes, so that has the same loudness, pitch, and duration, but still sound differently. So if you take two instruments, so like the flute and the piano, you might have the same loudness, pitch, and duration of sound, but they sound different. And so the timbre is how that is distinguishes between two different sounds or two different instruments that have the same loudness, pitch, or duration. So now let's move into the ear and the anatomy of the ear. So we have the outer ear. The sound waves first pass through the outer ear. So when a noise is made, it first passes through the outer ear. The outer ear consists of the pinna, which is the part that sticks out from out of the head, and the auditory canal. It's a tube-like structure that is 3 centimeters long. The outer ear protects the tympanic membrane, also known as the eardrum, and it protects the inner ear. The middle ear It is when the sound reaches the tympanic membrane, the vibration is sent to the structures of the middle ear. So it's the sound passes through the auditory canal and then enters into the middle ear. The middle ear is a small cavity which contains ossicles, the three smallest bones in the body. The malleus transmits the vibration from the tympanic membrane to the incus, which transmits the vibration to the stapes. The stapes transmits the vibration to the inner ear by pushing on the oval window. The oval window is a small membrane-covered hole in the cochlea. So then we're moving the vibration into the inner ear. So the inner ear contains the cochlea. It's a small snail-like structure which has fluid in it. So the cochlea contains hair cells, which are the receptors of hearing. So when the vibration meets the cochlea, it makes ripples in the fluid, which pushes on the tectoral membrane, which moves the hair receptors. As the hairs move, it creates an electrical signal, which is sent along the auditory nerve to the auditory cortex. So hearing loss is pretty common for the most part, especially as we get older. 17% of U.S. adults suffer from impaired hearing loss. Percuspis is caused by hair cell damage from exposure to noise over a long period of time. Percuspis can be caused by drugs that damage the hair cells or age-related degeneration. Percuspis affects more males over females, and this could also be because a lot of males throughout history, when you think wartime, working in factories, it's heavily male that work there, working in noisy environments. Noise-induced hearing loss is caused when loud noises cause degeneration of the hair cells. This is mainly seen in people who work in noisy environments. So people that do work in noisy environments are unfortunately more at risk for hearing loss, especially in their future as they get older. So just summing up this presentation, sound can be both a physical stimulus and a perceptual response. A sound stimulus occurs when the movement or vibration of an object causes pressure changes in the air, water, or other elastic medium, which can transmit vibration. Loudness is the quality of sound that ranges from soft to loud. Pitch, the quality of sound which ranges from high to low. The changes in pressure repeats is measured in the units called hertz. The pressure of a sound stimulus relative to a reference pressure is measured in decibels. The outer ear, middle ear, and inner ear receives the signal, transmits and amplifies the sound, sending it to the brain to be processed in the auditory cortex. And then hearing loss can happen through medication, age-related, and then working or being involved in noisy environments. So that is my presentation on hearing. Thank you for listening.